So this presentation provides a very brief overview of weight bias towards individuals who are affected by obesity. When we talk about weight bias, we are generally referring to negative attitudes towards individuals who are overweight or obese. And negative weight-based stereotypes are very prevalent in our society, and they often lead to stigma, rejection, prejudice, and discrimination. And like other forms of stigma, weight bias occurs in multiple forms. It can occur in the form of verbal derogatory comments, physical aggression, something called relational victimization, which involves being ignored or excluded, and even cyberbullying. So it's important to recognize that weight bias has both subtle and overt forms. Weight bias is a significant priority in our society because millions of children and adults are affected by stigma and prejudice, and this leads to very serious psychological consequences, as well as pervasive social and economic inequalities, adverse effects on physical health, and overall reduces quality of life for those who are affected. This is also a priority because it can really interfere with policy efforts to effectively address obesity and improve the food environment. When we look at the science on weight bias, this is an issue that has now been studied for several decades, and we see substantial evidence of bias and discrimination towards children and adults who are overweight or obese in multiple settings. We see this in the media, where there are very negative portrayals of obese individuals in television and film and even news media. We see this in employment settings, where there are inequitable hiring practices, lower wages, and wrongful termination. We see this in educational institutions and even in healthcare settings where patients experience bias from healthcare providers because of their weight. We also see this in interpersonal relationships between family members and friends. And unfortunately, we see this towards children who are affected by obesity, who are very vulnerable to bullying and victimization because of their weight. When we look at just how common this is among adults, we see that rates of reported discrimination are very high when it comes to weight. What this slide shows is research that we have conducted with a national sample of adults, and the blue bars refer to reports of discrimination among men, and the red bars refer to reports of discrimination among women. And what we see is that weight discrimination is the second most common form of discrimination reported by women, and the third most common reported by men. So this is a very prevalent problem among adults. When we look at children, weight bias really occurs in the form of teasing and bullying and victimization, and this has become a significant problem for today's children and adolescents. Our research has looked at just how common this is in the school setting, where we surveyed over 1,500 adolescents and asked them to tell us what they perceived to be the most common reason why they are teased or bullied at school. And what you can see here is that students perceived that being overweight is the most common reason that their peers are bullied or teased in the school setting. As part of this research, we also asked students to tell us what kinds of weight-based teasing and victimization they observed towards their peers. What we see is that 92% observed their peers being made fun of because of their weight. 85% specifically saw them being teased or bullied during physical activity like gym class. 67% saw them being excluded from activities at school, and over half saw their peers being verbally threatened or physically harassed because of their weight. We see that perceptions of teachers are very similar to those of students. This is a report that came out from the National Education Association in 2011, in which they surveyed thousands of teachers across the country and asked them what they perceived to be the most problematic form of bullying in the school setting. And what you can see here is that weight-based bullying was perceived by educators to be the most problematic form of bullying. So when we consider the consequences of weight bias for both children and adults, we see a range of social, psychological, and physical health consequences. First of all, when we look at social and economic consequences, we see that those who are stigmatized about their weight face tremendous social rejection and less peer acceptance. They also report lower quality in the relationships that they have. For children and adolescents, we also see that weight-based teasing at school leads to worse academic performance and avoidance of school. And among adults, we see that this leads to inequitable hiring practices, lower wages, and prejudice from employers. Specifically, when we look more closely at academic consequences, we see that among adolescents who are teased because of their weight, they report that their grades are harmed because of weight-based teasing and bullying, and they also report avoiding school in order to escape weight-based bullying. We found in our research that the odds of students reporting these consequences increased by 5% per teasing incident, even after we accounted for things like gender, age, race, their grades, and their weight status. When we consider psychological consequences, weight bias increases risk for a range of different psychological problems, including higher risk of depression and anxiety, low self-esteem, poor body image, and suicidal thoughts and behaviors. The suicidality is especially concerning for youth who are teased about their weight. Some research has found that these children are 2 to 3 times more likely to be engaging in suicidal thoughts and behaviors compared to their overweight peers who are not being teased. There are also significant consequences of weight bias for eating behaviors. When children and adults are stigmatized because of their weight, they are much more likely to engage in chronic dieting, unhealthy weight control practices, eating disorders and binge eating behaviors, increased food consumption, and a higher dropout rate from weight loss programs and less weight loss. This is really important to highlight because there tends to be a public perception that maybe stigma is not such a bad thing, that maybe it will motivate or provide incentive for people to lose weight. But what we see here from this research and from other studies is that the opposite is true, that weight-based teasing and bullying and discrimination lead to behaviors that instead can impair weight loss efforts and reinforce obesity. Similarly, we see that when those are teased about their weight or stigmatized about their weight, they are more likely to avoid physical activity. This is especially true for children in physical activity settings like gym class. And there are also studies now showing that weight bias increases risk of cardiovascular health problems like high blood pressure and increased cortisol reactivity. And finally, studies also show that when patients experience weight bias in the healthcare setting, they are more likely to avoid future healthcare appointments because of those experiences of bias. When we consider all of these different consequences, we can see how bias and stigma and discrimination lead to diminished income and education, avoidance of healthcare, diminished self-esteem. It has a negative impact on physiology, as well as impaired ability to lose weight, psychological disorders, and diminished social support. All of these things can increase morbidity and mortality, and this is an important big picture to keep in mind. Because weight bias has become so socially acceptable, it is rarely challenged and often ignored. However, there is increasing recognition that perhaps prejudice and discrimination related to body weight may be interfering with our efforts to effectively address obesity. And it's important to recognize that weight bias is both a social injustice and also a public health issue. So in our public health efforts to address obesity, we must ensure that we increase attention to weight bias and its consequences, and that we make sure that weight bias is on our agenda. We need to use respectful language and messaging and imaging in the resources and materials that we put out about obesity, and we need to avoid approaches that shame and blame individuals for their body weight. Instead, we need to focus on specific health behaviors that people can engage in regardless of what their body size is. And when we see the presence of stigma, we need to ensure that we remove this from our existing efforts. The Rudd Center has developed a number of resources to address weight bias. These are resources that are free and are available on our website. Some of these include the following. One is a media gallery, which is essentially a repository of hundreds of images that depict individuals who are overweight or obese in non-stigmatizing ways. These images are designed to challenge negative weight-based stereotypes that are so pervasive in our society, and this gallery is free of use for individuals in the media, researchers, educators, and healthcare professionals. We've also developed several educational videos to increase awareness of weight bias and its consequences. One of these is for children and one is for parents and educators, and we also have a third that specifically addresses weight bias in the healthcare setting. These videos are very brief, about 17 minutes in duration, and can be used in multiple training settings. We've also developed a course on weight bias for healthcare providers. This is a free educational course that individuals can receive AMA credit for, and this is also available on our website at yaleruddcenter.org. We've also developed clinician toolkits on weight bias, and also policy briefs for policymakers who are interested in this issue. When it comes to policies, there's a lot of action that needs to be taken with weight bias. One area is in relation to anti-discrimination laws to help protect individuals from weight discrimination. Other areas include state anti-bullying laws and school-based anti-bullying policies to ensure that children and adolescents are protected from bullying because of their weight. If we want to shift societal attitudes and reduce weight bias, we need to think big, and this requires us to change the way that the media portrays body weight, to challenge the pervasive weight-based stereotypes that are so common in our society, to educate the public about the complex causes and solutions of obesity, to implement anti-bullying practices that include body weight, and to legislate to prohibit weight-based discrimination. If you'd like to learn more about weight bias, please visit our website at www.yaleruddcenter.org.